Okay. All right. So we'll wait for just a little bit before we get started. But this is the Ask NBIIC event with the Brain Injury Association of America. For those joining us, thank you very much. For those that had contacted us, thank you as well. Okay. All right. So, as I said, this is the Ask NBIIC event. But before we kind of introduce ourselves, I thought it would be helpful to maybe explain and describe a little bit about what exactly NBIIC is. So, NBIIC stands for the National Brain Injury Information Center. It's a cornerstone program of the Brain Injury Association of America. It's mostly associated with our 800 line, but NBIIC really is more than that. It's several things. It is the 800 line. It's the email and the contact forms on the BIA website. It's basically the way BIA works to connect with people impacted by brain injury with brain injury specialists. It's a place people can communicate with a brain injury specialist to ask about anything related to brain injury. So NBIC does a couple things. It works to connect people with brain injury specialists, and it works to connect people with local specialists too, which is why the 800 line, when you call, ask what state you wish to reach. So NBIC works to offer help, hope, and support for those impacted by brain injury. We work to gather information on a wide range of programs and resources across the country. And my fun fact, the last four digits of our 800 number, which is 1-800-444-6443, the last four digits of the 800 number are actually the acronym for the National Head Injury Foundation, which was what Brain Injury Association started as way back in 1980. So that 800 line has been around for a long time. So I hope that's helpful to explain a little bit about what NBIC is. I thought also we'd get a chance to introduce ourselves a little bit. First, I'd like to introduce Heather Maddie, who's our Information and Resource Specialist. Heather, welcome, and why don't you tell folks a little bit about yourself?
Thank you. As you said, my name's Heather Maddie. I started working in the field of brain injury in the late 90s. I worked at a Center for Independent Living with persons on a brain injury program in the state I was residing. And then I worked at the Kansas Brain Injury Association office for several years. And 3 years ago, I transferred to the national office.
Excellent, and we're very lucky to have you.
Okay.
Um, and I am Greg Ayotte. I'm the Director of Consumer Services with the Brain Injury Association of America. I've been with BIA in two different tenures. I came from working in a brain injury rehabilitation community reentry program in Maryland. Then I came to the Brain Injury Association in 96 and worked there to 2003 as an information and resource specialist. I went back into brain injury rehab in 2003 and came back to the Brain Injury Association of America in 2006 as a director of consumer services and been here since. So we had asked for the Ask NBIC event for folks to send us questions. We had a contact form and we weren't quite sure what to expect, but the response was overwhelming. We had almost 150 questions asked, clearly more than we could ever kind of really respond to. So what we have been going through the questions and try to categorize them in kind of these common themes or ideas or issues that keep coming up, and thought we would look at and talk about three different themes. These are not all of the themes that came up. Another kind of side note is if you had submitted a form, we are working through and responding to those forms as well. We'll email you back with whatever information we think could be helpful. Please, a little bit of patience as we go through them, and certainly as we send information, if that kind of brings up more questions, reach back out to us. Absolutely. So we understand that sometimes it can take, 2 or 3 conversations to really start to piece together information that's going to be helpful for your situation. But I thought we would start with, so we said we had looked at the questions and kind of came up with these kind of themes. So one of the ones that kind of kept coming up in different ways was basically explaining brain injury to others, whether it's loved ones, friends, employers, colleagues, whoever it might be. The idea of how do you explain brain injury to others? So, Heather, I'll let you kind of take the um, first response to that, and we'll certainly kind of see what we can add to it.
Thank you. Explaining brain injury to others is a topic that we get often. And for the person with the brain injury, um, sometimes this is really difficult, especially when that's a hidden disability. That's something we get quite often is everyone says you look fine and they just don't understand the person's brain injury. And a lot of times it's very helpful for the person to provide education. And we have a model knowledge system center on our website that has fact sheets on a lot of topics of brain injury, everywhere from cognition, memory, headaches, just a lot of different things. And a lot of times that is a really good way to help educate the person. And another thing is each person with a brain injury is like a snowflake, not two are alike. And a lot of times explain that to the person too. Um, each person with the brain injury is different and have different needs and different symptoms. And another way um, that may be helpful for caregivers, especially, is going to a caregiver support group, which you can call the NBIIC number and ask for a list of support groups, or if you're in a state with the affiliate, the support groups in their area.
Great suggestions, ideas. I'm gonna kind of repeat what you said, but in a different way. Um, some of the things that as you said, we hear this pretty regularly. I'd say kind of how explaining it. And so our kind of mantra has been, the right information to the right person in the right format at the right time. So each person, not only is each person's injury going to be different, but each person's kind of learning curve on them being able to understand brain injury will also be different. So it may take several conversations with somebody to kind of get them up to speed and help them kind of wrap their heads around kind of what brain injury is. So we usually say it's information is definitely going to be key. Information about brain injury, what to expect. As Heather had talked about, the model systems, the Knowledge Translation Center has great information on different kind of common topics or issues that can happen. There's also good information on the Brain Injury Association of America website, on our YouTube page as well, kind of helping to explain some of the kind of more common issues that someone might experience. So I think when you're sharing the info, part of it is, I think, the information, the model systems. Part of it is too kind of maybe sharing some other stories, like
Mhm.
hearing that other people have experienced this as well. That can be helpful to family and friends understand, like, oh, it's not just my loved one. This happens a lot more than I realized, and it's a process. So I also put a caveat in there: is you can do everything exactly perfectly correct, and if that person is not ready to understand or accept the injury, there is no amount of information that's going to change that belief. I think that's the other challenging part is you may come across folks who are adamant that because your injury was mild, you should be better. You're walking and talking, you should be fine by now. You're just doing it for attention.
Yep.
For those folks who have those kind of rigid beliefs, sometimes information and other stories is not enough to get them to kind of change their beliefs. And that's the point for me. What I usually tell folks is it's important for the person with the injury to make sure they're surrounding themselves with folks who are willing to listen and learn, surround themselves with a supportive network of some way, shape, or form. And there may be people where you kind of limit your contact with them,
Mhm.
or understand that they're not going to be as supportive as you would hope that they would be. So that might change the relationship. And that's a sad truth, but it's something that we certainly see happens. So there's no magic formula. There's no magic words that can be said. I was trying to think about kind of one of the stories from the helpline to kind of examine this, and I am blanking on where they were from. I want to say California, but I could be wrong. Where the person with the injury had a family that just assumed they should be better by now. It was a relatively mild injury, and it was well past a year post, and the person wasn't able to get back to work. And everybody was kind of getting on them like, you should be better by now, you should be better by now. And it was the family hearing the story from somebody else, unslit, like it was not solicited. It was not something we sent. It was not something the person with the injury sent. It was just they were on I want to say they were on like either a Facebook group or someplace, and they heard this story that mirrored what their family member had experienced. And seeing it kind of a step removed was what worked. Was all of a sudden the light bulb went off, and the family was like, "Oh, maybe it is real what they are experiencing." And that's the best you can hope for, right? If once they start to say, could it be real, that changes everything about the assumptions they might make, the decisions that they come to. So it's always trying to give the family member the time and space to kind of go through their own learning curve, and always be mindful of those teachable moments, right? Those moments where you can kind of share information with them that might help move it along. It's not a perfect formula, but it works pretty well. Um, Heather, one thing I wanted you to talk about was the importance of the support groups for the person with the injury as well in this whole process.
Yeah, for many people with brain injury, going to a support group is very important because, like as we were saying before, a lot of people, their families or their friends aren't understanding. And it's really good to have support of other persons that have had a brain injury, to sustained a brain injury, to understand, just not like um there I lost my train of thought. Um, just not being around um because you feel alone sometimes, but also seeing how others cope with it, the
Mm.
skills they've used, just different things that have helped the person. And like going back and forth, I tried this or and different things, and just having somewhere where you can feel your emotions. Because for a lot of people after a brain injury, like if there's problems with the family or caregivers, like with their emotional state, sometimes it's important to be with other people that understand you so you can feel your emotions and express them.
Yeah, I think that's crucial, is getting that emotional support as you're struggling with getting or trying to figure out how others can accept it. Because it can feel very isolating, right? And overwhelming. You're like, holy smokes, how am I gonna change this? And so hearing from others, being able to be in a place where you can explain the injury and people get it,
Yes.
is not to be underestimated. That is, even if there's nothing exactly practical you walk away from the support group with about another strategy or tip, like just the ability to be able to talk to others that get it in and of itself is at least like a little bit of a release valve, right? A little bit of a, okay, all right, I'm not the only one. Let's regroup. Let's rethink how I want to approach this, and kind of it's hard to do that, I think, if you're not getting support. All right. So, kind of the flip side of that is the other kind of theme that we got was I kind of boiled it down to explaining brain injury to yourself. Like, how do you begin to understand and accept what has happened without giving in? That's the balance. So, I don't know, Heather, you've had some fantastic tips and strategies you've shared with folks on the helpline. I thought maybe we could talk about those.
Yeah, and like the acceptance and the adjustment part. For a lot of people, like when you're in rehab in the beginning or whatever, they're teaching you new ways to do it. And they're accepting you to adjust. But for a lot of people, until you accept the changes, it's very hard to do the adjustment. And that's for the caregivers as well. Um, it's just the person with the brain injury, there are differences, and then you're given all this stuff at once and it gets overwhelming. And then we get calls from caregivers and survivors as well, like, I can't accept the changes. And a lot of that is, I have suggested to several people, and I have done this myself, is writing a letter to your old self before the brain injury, saying goodbye to that person. Because a lot of times it's you're not realizing the comparisons you're doing before, and just writing a letter to your old self to say goodbye is very helpful for both caregivers and the person with the injury. And the second part of that, and this for some is a lot harder, is saying hello, welcoming the new self. And I'll give an example for myself. Um, I did this after my injury, and what I saw was like when I was saying goodbye to my old self was that how I was before, there was some things that I was really like OCD in some ways. Everything had to be organized one way and everything had to be on track and scheduled. And then when I said hello to my new self, I'm like, hey, this is going to take less time of my day because I'm not going to be as obsessed as I before. And just kind of welcoming the changes. And I, several other people have done this as well, and they really found that that was beneficial. Is just saying goodbye to the person that you were before, and just welcoming and accepting the person who you are today.
Yeah, I think that's a fantastic idea and a good suggestion for folks to use. It is it is a process. It
Hmm.
is not a flip the switch and okay, I'm ready to move on. It is a process. There will be days where you are
You
looking
still,
forward,
yeah.
right?
Hmm.
And then
And
there's days where you look back and you're like, damn it, this used to be so easy and now it's hard. And it's pretty normal, I would say, to get frustrated at the changes at times, even years post injury. I mean, certainly we've heard from many folks who are years post injury have great compensatory strategies and still get mad at themselves. Like, I used to be able to balance my checkbook, no problem. Now I can't, now I need to have someone double check it because I'm not sure. So they know, and they're effectively found a really great compensatory strategy, but it's still different. It's still, they're doing it different than they used to. And there can be moments of frustration with that.
yeah, there still is. I mean, like you said, it's a longer process, and like a lot of times for people, it's helpful too. Is like um, making a list, like of the skills that you use, and like check off this work, this doesn't, so that you are more aware of what things have been beneficial than not. Because you're, like I said, you're throwing a lot of different things, and sometimes it's more helpful to do that, to be aware.
So this is very much a generalization, but this it was drilled into my head when I first started working in brain injury. Um, my first boss used to say, you spend the first 2 years after your injury looking back, trying to figure out how to get back to where you
Mhm.
were, who you were, what you were able to do. You spend the next 2 years trying to figure out how to make the new you work. What's the strategy? What's the thing? What am I capable of? You spend the next 2 years kind of honing it, right? Kind of really trying to figure out what works for you, trying to living with a brain injury. And then you spend the next 2 years looking to pay it forward, give back some way, shape, or form. That kind of process of uh, coming to acceptance, building some competence in what works for you, and then looking to kind of help the next person. And that's very much a generalization, and not everybody goes through it in
Mhm.
that time frame or gets to those points. But it's the I see that type of process play out over and over of trying to figure out how do you how do you accept without giving up, right? How do you accept with and realize that certainly, I'll say the other thing when I first started was, school of thought used to be after the first couple of years, that was it. You were done. IQ static, 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 brain was static. We know that's not the case anymore. We know that the brain's much more dynamic. It can change. You can have changes years post injury for good and bad. And that uh, you can improve skills over time um, with effective compensatory strategies, good awareness, good support, and all the other stuff that goes with it, right? All the stuff we know we should do becomes more important. The good nutrition, hydration, trying to stay cognitively active, all can impact in kind of how you move forward.
And like, you know, part of it is like with the acceptance, is like back to the support groups and stuff too, because sometimes it's like educating yourself as well. Like, um, for many people, they're still stuck in the hole because they don't understand like all of the brain injury. And for some people, it's been very helpful for them to keep a symptom log
Hmm.
because sometimes they're not aware.
Hmm.
And for some families, they kept one, and then the person with the brain injury has kept one, and they see the differences and then discuss it because sometimes they're not aware of the symptoms they're having. So having that has been helpful for a lot of people too.
Yeah, that's a really good point. Like knowing you might need some outside help to understand your injury a little better and be willing to. I think when the person is at that point of trying to figure out what do I do next, they should be open to constructive feedback about what other people are seeing because they may see things right you're not fully aware of, um, and they may say it in a way that it crystallizes for you like, oh, that's what I'm doing.
Mhm.
And so it helps to kind of get that feedback from others.
And I heard a story from someone that she was a caregiver, and the caregiver kept on bringing up the symptoms and different things that they were seeing, and the survivor just didn't want to listen. When it was a friend of his, then he took it more, and I mean, that happens quite a bit. They just and the same for the caregiver. Sometimes it takes an outside source for them to realize, but sometimes the immediate caregivers for the person with the brain injury, it's harder than seeing it from outside, and the same with caregivers.
I think it's back to kind of what we were talking about before was that just for the loved ones and family members, they go through their own learning curve,
Hmm.
right? It's the same for the person with the injury. Like it's not light bulb doesn't go off. It's a process to start to piece this together. Like, what does this look like for me? What's my day to day look like? What am I capable of doing? And how do I, what do I do to better that? What do I do to try to improve it? Those are not easy questions to answer. And it definitely takes info and feedback and suggestions from outside folks. So you have to give yourself the time and grace to kind of what I used to tell people when I was working in the community ranch. I'm like, we are going to try 5 things. 3 of them might fail miserably, but we're going to learn something from those failures. Like, why didn't it work? What did not work for you for that? And then we're going to try 2 things. It's going to work great. It's perfect for you. I'm like, it is trial and error about figuring out strategies and tactics that work for you. So you have to give yourself that space to try something. And if it doesn't work, to try to figure out why it didn't, why didn't that work?
Mhm.
What was the barrier? Why was that not effective for me when I saw it work for this other person in the support group? Being able to ask those type of questions can be a big step forward in trying to figure out some strategies that would work. And my example is I am a paper calendar, like that's how I grew up using a paper planner. I'm still a paper planner person. And towards the end of my time working in the brain injury, they had more of those, like, Blackberries and stuff coming out. And so we had a gentleman come through the program. He was using the Blackberry. He was using this to do all this stuff. And so I was thinking, well, you need to write it down so you can see it and stuff like that. I'm like, no, man, this was that skill was still intact for him. Like that tool worked for him where he could type in his stuff on his calendar, know how to set the alarm. So he was still able to use it, and that worked for him. Like, it was not I to me, that would never work for me. Right. That's not what I so it's that idea of, okay, let's try to figure out what's going to work for you. What's the thing that is in your comfort zone that is going to be helpful?
And
And
for
again,
some people, the expectations are too high and of themselves and the accommodations at work and stuff. And I had someone tell me, and I tell this to people, it's progress, not perfection. And that is something
that's, yep.
that really has helped me and other people because it's a progress and just, and sometimes accepting that, the expectations are up here of how you think you can be. And then, like he
Mhm.
said, trying over and over again. And finally, it's just like accepting that that is not a reasonable accommodation, but you've made progress trying to get to that point. So that's a good thing to tell people too.
That's a really good point. Yeah. It's like there's no like one magic formula, right? There's no one magic strategy that's going to be perfect. It's going to work for everything. No, it doesn't work. I want to add one more thing that your mind popped in my head. So, just like everybody else who have good days and bad days, days where
Mhm.
stuff's clicking, stuff not clicking. So it's important to be aware of that, because I've seen this a few times where they have a strategy and all of a sudden it's not working because they've been feeling run down, or they might have had an infection, and whatever was going on, but weren't getting good sleep. Something changed, and all of a sudden the strategies aren't working. Don't That's the idea of trying to get constructive feedback, or really think about, why is this not working? Well, it could be the fact that you haven't slept well for the last three
Mhm.
nights and your cognition is not where it normally is. So whatever strategy you're using, not working right now. So focus on health, kind of getting healthier, kind of feeling more like you normally do, and then see if the strategy is still working or not. We hear that a lot, is that something that works all the time and something changes in their life, and all of a sudden the strategies aren't working. I'm like, well, it might be you have something more pressing to take care of, right? Your own health, your own mental health, before you start throwing out strategies and say, oh, this doesn't work anymore.
And the thing with the strategies too is I tell people there was one that I had tried. They're like, "Oh, you have to try it this way." And I did. I'm like, "Oh, that doesn't work." But the more they were bringing that to my attention, and this happens with a lot of people, you can't just try it once. Sometimes it's a process and you have
Yeah,
to because it's like, "Oh, this didn't work." And then the person gets frustrated, but maybe sometimes the first time isn't one that's going to work. Sometimes you have to keep on practicing it. And that has worked for some people.
that's a really good point to bring up, is that as you're going through this, starting any new habit, strategy, behavior, there's a period of time in the beginning where it does not feel natural and normal at all, right? Like, this is not how I normally do things. Well, if you can right, continue to work at it and try to it starts to feel a little more comfortable. At that point, you can see if it really helps you or not. Does this really help or not? So it is yeah, that's an important part is to kind of give yourself time to kind of implement, use the strategy, see if it is really helpful for you. Um, thinking about, we had a gentleman that I worked with who used to keep everything in his head. Like, guy, he was brilliant before his injury, um, and had some significant memory issues. And we, trying to figure out what the strategies or tactics that might be helpful for him. And so he was an old school guy like me. So he liked the paper and pencil. He liked having it one place, writing it down. So we worked on using a planner for him, right? So a section for the notes, a section for his appointments, a section for his to-dos, and he knew where stuff was. And he hated it first, hated it, because it was not what I mean, he felt like it was a waste of time because it's stuff he was spending time on things he never had to spend time on before. But realized that as he continued to use it, like, oh, I'm not forgetting as many appointments, and I'm keeping better track of my kind of to-dos and how long it takes to do stuff. And so yeah, it took a solid month of kind of trial and error using it, trying to figure out what works for him. Um, but after about a month, he felt a little more confident in it. And I remember seeing him a couple years after I had left the program, still using it, same process, same thing. He's like, this is it. This works for me. This works great for me. I know where my stuff. I know where stuff is. I'm confident that I'm not going to forget something because I know I wrote it down and I know where that is and I know I check it each morning. This is the schedule of my day. All right, we could talk about that for another hour. The other kind of theme that we got in very different ways, but the kind of boiled down to again is basically things to do to help myself as I get older. Aging with a brain injury. So I put those in kind of two buckets. What do I have to be worried about? And then what can I do to kind of help myself? I guess, for lack of a better term. But I know, Heather, you've had many of those type of questions. I know you have some ideas, thoughts about that.
Yeah, as you get older, pre-injury, like before anyone without an injury, as they age, there's changes in your brain. There's changes in everyday life, your situations. And with as you're aging, it's really important to um, make sure you follow up with physicians' offices. Keep an eye on symptoms. If you have new symptoms, just make the professional aware. And one thing that I don't like that is recommended is you have to have neuropsych testing like every 5 to 10 years after an initial injury, which is
Mm.
yes and no. But as you age, they say that that is important, but there's different thoughts on that. But that is one thing, keeping up, seeing if there's been any changes. And Greg, you disagreed with that.
No, I mean, I was saying, yeah, I'm not a big fan of neuropsych testing every 5 years. Like, normally, my school of thought is you're going to do a test if you think something's different. I wouldn't do it just to do it to know what I score at, 50 versus 40 versus 30. I would say,
It's
well,
mainly for people that want that they see changes or the family member
yeah,
sees
that I
changes.
would agree with. If you see some changes, it's certainly worth investigating to see what's still working, what might be different from earlier post injury. I could see that. I could see that. Um,
Because as you know, as you get older, the doctor's office start asking you questions every time you go into. That's like for everybody. So that's one thing that make doctors aware too if they see any changes.
yeah, I kind of like to look at this in kind of two. different frameworks, I guess. So one is, what can you do first, right? So what are the things you can do kind of proactively can be helpful?
Diet, exercise.
Yep.
Um,
Diet, nutrition, hydration, exercise, using continue to use cognitive skills, right? So all those things become important, and some type of social
yes.
connection, some in some way, shape, or form, whatever that might be. So those are things that we know are supportive of just overall good brain health as you age. So for someone with a history of an injury, I think those become more important. Um, so as the one of my old boss used to say, like, yeah, everything your mother told you was right. Go outside and play, eat your vegetables, drink your water, whatever it might be. So, um, but those are the things that we know can be helpful. I know there's a lot of, we got several questions too about like supplements and vitamins, and I've never seen anything specific to brain
Mm,
injury about supplements that we know will kind of work on a big scale. That is definitely a discussion to have with a doctor, a pharmacist,
nutritionist.
nutritionist about what might be helpful for you. Um, I can think of one example of there's one uh, person with an injury that had been in touch with us over the years and had shared about kind of his um, struggles with being in a fog and kind of fatigue issues. And he finally went, he had just been complaining about it, not doing anything about it. And he went to the doc, and the doc took blood test. He's like, yeah, you're really low in vitamin D. Started taking vitamin D pills. And I think one other one. And for him, that worked wonders because it was clear like that was his, they had some info to say like that's going to work. So it's that idea of ask those questions of your medical providers of what uh what could be helpful from a vitamin or supplement standpoint. um on the flip side is the what should I be worried about.
Yes.
This gets trickier because brain injury is a risk factor for, right, a lot of things. There's information on our website and elsewhere about kind of the brain injury as a chronic condition and what the potential risk factors are. So I'd encourage folks to kind of read through some of what the literature talks about because there's Parkinson's and cardiovascular and a few others.
Endocrine.
Yeah, endocrine issues that are all could be, potential issues longer term after the injury. And so if you're aware of that, that can be a discussion you have with your primary care doc about kind of being proactive. And if there seem to be symptoms that match up with any of those, like, oh, let's do some tests. Let's find out. Let's look at this because this could be it. So it's one of those where if you catch it early, right, there's more chance of some intervention that can be helpful.
Yeah, and a lot of people call, they'll see a research thing on it, and then that starts to worry them a little bit because but each research study is so different. I mean, as we know, research is an ongoing thing, and it's different populations with brain injury, it's different things, and sometimes the research just it does not match with the person with the injury because there's so many different factors, and sometimes that's when we recommend to see a doctor as well.
Yep. So if you're if you can bring to the doctor the like our position paper on brain injury as a chronic condition where it kind of just lays out a little bit about what the research says, bring that can be helpful, kind of saying, well, I'm not, you know, jumping to conclusion. I just want to be mindful of these risk factors and say, okay, well, let's go see what can we test for? What can we see? What can I do to kind of continue to minimize the risk of those issues?
And oftentimes we'll hear that the doctor doesn't understand this doesn't, and sometimes it's asking to see a specialist in that area. Like if you're having issues with your hormones, it's an endocrinologist, it's a
Hmm.
vascular doctor, just there's different specialists because we do hear that from sometimes that the doctor doesn't understand this or believe what I'm saying. So sometimes it's asking to see a specialist in that area.
There's a really good interview that I did with Dr. Maisel, our medical director, around the kind of the long-term health implications of brain injury. He did a really nice job of kind of spelling out, right, some of those issues, tips for having the conversation with your doctor, those type of things. So I'd encourage you to go look that up on the Brain Injury Association of America website. It's also on a YouTube page, I believe,
Yes,
too.
it
So
is.
that could be helpful. All right. So the last, I'm going to throw a curveball at you, Heather,
Okay.
only because I see this question, and this really is a very kind of common issue. What do you do if you have a mild injury and your
Mhm.
neurologist says your scans are normal, so it's not a brain injury, but it's probably mental health?
Yes. We
Uh,
see that quite a bit. And because here's the reality. CT scans and MRIs are not do not always show, especially with concussion and post-concussion syndrome. That is just a common normality. That's where sometimes getting a neuropsychological exam, which is neuropsych is an assessment of cognition, memory, behavior, what's the other word I'm looking for?
Fine motor
Fine motor.
skills.
It's
Yeah,
it's a longer test, but that often shows things way before an MRI or CT scan does.
you have to give
And
him
another
more
thing in
data.
that is some neurologists these days have specialty fields. And sometimes with brain injury, going to see a concussion clinic that specializes sports medicine, especially, a lot of times have concussion programs that are not related. That it doesn't have to be sport related to go see them. And
Hmm.
another thing is a physical medicine and rehab doctor that specializes in the brain injury. They more understand um, brain injury as a longer term condition, and they understand it more. So, like, I know w- there was a lady who was seeing a neurologist, and they kept on saying, "Oh, you're fine, you're fine." And she finally got another opinion because hers was more post-concussion syndrome with with the concussion clinic, and it was a rapid change
Hmm.
because the neurologist they sent him to was not as familiar with post-concussion syndrome. And then she had the
Yeah.
different testing from the the concussion specialist, and that was a big help for her.
Yeah, I think the takeaways from that, right, are whoever you go see, please let them have some experience assessing brain injury, concussions, mild injury, and get multiple types of evaluations. Right, you're going to look at this injury a few different ways. The other caveat I'll add is, right, if you're, I would totally agree with, if you can get to a concussion clinic near you. I mean, they have seen these cases before, so they're much more familiar with how to evaluate. If you can't, if you're trying to find a provider, if you're looking for a neuropsychologist, please ask the neuropsychologist if they've had experience assessing mild brain injury. Half of the test is knowing what tests to give. The other half is knowing how to interpret the results. So it's important for whoever you go see that it have some experience in brain injury.
And I saw the questions, and many providers do not understand. How are
Yeah.
you going to help? A lot of this is education.
It's a lot of yeah.
It's a lot of education. I mean, part of like the outreach is we send information to our organization, a basic on brain injury, and a lot of that sometimes the patient has to. I know with myself, I had a doctor that didn't understand, so I like gave him some material about the issue that was going on, and it really helped them to understand. And sometimes, it's like educating, educating, educating.
It's that same process we talked about initially, right? About trying to educate family, and like they have to go through their learning curve, and you have to figure out what information and what format's going to work for them, going to help them understand. So is it journal articles? Is it, fact sheets from an organization like us where, we've gone and kind of gathered info from several different sources, whatever it might be. it can be helpful, right, to kind of share some info to try to help shape a little bit about some of the understanding for brain injury. The other thing I usually also tell people too is share our 800 number with a provider.
Yes, yes.
So a lot of times what we would get is the calls where the provider, the primary care person might be like, all right, yeah, it's a brain injury. I have no idea what to do. I don't know. I don't have a network or referral. I don't know who to
Mhm.
send them to. Like we get calls from providers' offices regularly trying to figure out, well, where are the programs near me? Where are the groups? Where are the resources? So certainly share our 800 number. We'll talk to anybody that calls us. I'm looking at the other questions. Yeah. ER docs is that's their that's an own that's a
They're
whole
like, "Get in and out."
that's a whole session. ER docs, this is just my opinion. They're they're trained to evaluate trauma, not necessarily injury, and those are two different things. So they will look to see if there's anything that needs immediate medical care. If you are considered to be stable, they stop looking. They're not going to investigate. They're not going to do any more subtle testing. They're just looking at, do we think there's a bleed or not? I don't think there's a bleed. Okay, just go home, rest for a few days, take it easy. So um, it's a
That's where the follow-up with, your family doctor to get it and
yeah,
often with insurance, you have to get a referral to a specialist, and that's where
yeah.
it's important.
Those are great questions. Great questions. So all right. So I thought I would try to put a bow on this a little bit, wrap it up, and say we hope this has been helpful. We didn't know what to expect as far as the amount of questions, and we hope it's been helpful. As I mentioned, for folks who had submitted a form, we'll be responding to those, um, throughout the coming days to make sure that everybody gets some type of response. You're always welcome to call us, to email us, to follow up if you have more questions. Um, I guess the kind of the takeaways for me, I would say, is get support, educate yourself, and work to educate others using materials from us um, to help people understand the injury a little bit. And the last, I don't know, nugget of info I would say is wherever you go, whatever, even information that we send or you might hear in a support group, there might be things that are exactly spot on. Like, "Oh, that's exactly what's going to be helpful for me." And then stuff where you're like, that is not me at all. Because every brain injury is unique. So everyone's experience will be unique. So you might hear strategies and tips, and you might think three-quarters of that is pretty good and 25% is useless for me. I always would tell people that I worked with, I'm like, take what you need and leave the rest.
Mhm,
If it doesn't all fit for you, just use the part that does. Just know that you are putting your own puzzle together and you may find pieces in different places. And so you're on the lookout for the pieces that work for you. You're on the lookout for the things that, yeah, I think that works for me. Anything to add, Heather?
you got it.
I hope this has been helpful for folks. I really enjoyed reading the questions. Like I said, we'll be kind of responding to those as well. Um, Please, like I said, use our 800 line or website if you have questions, looking for more information. Thank you, everybody, for participating today, and take care. We'll see you.
Thank you.